are you doing today?
Hi Varshini, I'm alright. What about you?
Yeah, I'm doing great.
So this is going to be the last episode of Medbike this year.
And I'm so happy to be a part of it.
So can you introduce the guest for us?
So today we are going to have Dr. Parashuram sir, who is a professor in the Department of Anatomy, and
Dr. Manjunath, professor in the Department of Preventive and Social Medicine.
so are you excited?
Yes, let's go.
Let's get started. Hello everybody. Today we have with us a very special guest. It's Dr. Parashuram sir, professor in the Department of Anatomy and the Student Welfare Officer of this academic year. I'm very happy to have you here, sir.
Thank you.
So how did anatomy as a profession change you as a person, sir? From the very first day you joined a medical college until now being a successful professor in the Department of Anatomy, how did your perspective of life change, sir?
It's all because of the dedicated teachers in the anatomy department from whom I learned regarding the academics, regarding the discipline of the students. So I think I bow my regards to my teacher where I was working at Vijayanagar Institute of Medical Science, Bellary, in the year 2003. So that was the first step for me to be dedicated and to be disciplined. So from there it started.
So it was clearly the teachers who shaped you into this career in being extremely disciplined and
100%. There is no doubt.
That's what we learned from you too, sir.
Thank you. Before that, I was a student of Sainik School, Bijapur, where a lot of focus was given for the holistic development of a student. So that was the beginning. And second one was the anatomy department dedicated teachers. So I think that's how my journey went on.
Really glad to know that, sir. Sir, anatomy as a subject, being a student in my first year, I really felt it very hard to actually understand the concepts behind it and visualize what the subject is about. And also dissection was extremely interesting and equally difficult also. Like starting from the smell of the formalin to carefully dissecting a nerve, it's a very hard and tedious process. So how did you manage all that in your UG days?
Anatomy was a very difficult subject for me. The opportunities was given to me as a tutor. I was asked to take the osteology classes. So slowly I started discussing with the students of first MBBS in the dissection hall, but still I was not well versed. So once I joined the postgraduate in the anatomy department only, so from first year to third year PG as a PG student, we were given very full freedom to dissect, to teach, and lot of opportunities to mingle with the students in the dissection hall. So that's how I think slowly I came to know that by dissecting, by being with the students, by being around the cadaver, definitely you can master the subject slowly.
Sir, what would you like to tell to the students who actually feel that anatomy is scary, like the diagrams as such, or even the dissection? Some of us were actually scared to perform the dissection. How to identify what is a nerve, like how to know what's a tendon and a muscle. It was all a very tedious and difficult process. So most of us were actually not willing to do the dissection as time passed because we were pretty scared. What if we do something wrong and we get scolded by our professors? So what do you have to tell them, sir?
First of all, cadaver is a first teacher. We know it is a preserved dead body. There is nothing wrong if you cut any structure. So by making mistakes, we learn. So that is confidence if we give to the student, definitely they will not be scared. And we ask students to be around the cadaver, so that by seeing the cadaver, by feeling the cadaver, by dissecting the cadaver, definitely you can learn. But it is as a teacher, it is our duty that any students commit mistakes, It's not a mistake, it's a learning. So we need to correct those and go ahead, that's all. It's not a live patient wherein mistakes are done and we lose the patient. There is no question of losing over here. So we have enough cadavers. That is how you can learn the skills and ask the students to practice also. So I give full freedom to them to dissect on their own and thereafter discuss and what mistakes they have done. So it can be corrected.
Sir, and also you're the student welfare officer for this year, sir, for this academic year. And how does it feel, sir? Because so many of us actually look up to you, and you're actually one of the most favorite teachers, like for literally all of us. And we really want to know how the journey of being a student welfare officer has meant to you, sir.
So what I thought is, at least I have to do justice being a student welfare officer. First and foremost thing is we have to attend to the students, whatever it is, whether it's a small issue or big issue, physically or digitally, over phone. If you can attend to them, almost 50% of their job is done. The second thing is, repeatedly if the students, different students from first year to final year, if they have any difficulties in them, you speak to them, you try to solve it, see that those difficulties are not difficulties for them forever. So that makes the students comfortable, and definitely any work related to the student and the teacher can be solved.
Sir, and personally, being a student, I have always had this curiosity to actually ask you this question, sir. When we had the first class of yours, when I was in my first year of MBBS, we did not even have a PowerPoint presentation. You came and you drew on the board, and the picture was so clear and it was so perfect. All of us literally jaw dropped. We were like, how is this even possible? We were struggling to even draw small diagrams, and it was so confusing for us. But when we saw you, you just walked in, and with so much of confidence, you used to draw. You used to use different chalks for different colors and make it extremely clear. And not just teaching as such, it gave us a confidence that probably even we can try. Like if sir can actually draw, maybe even we can follow him and learn from him. So like drawing it is actually pretty hard, sir. So how did you master that act, sir?
So we all know that practice makes humans perfect. So initially I was feeling very difficult during my postgraduate time also. So in the first year of assistant professor, it was a difficult for me, a difficult task even to manage the osteology class. But slowly when I started taking the theory classes, I used to practice 4 to 5 days before the theory and then the diagrams, whatever line diagrams are there in our textbooks. So I used to definitely practice and then come to the class. So that shows that if you are practicing, definitely you can achieve the diagrams. By default, I am not an artist or a skilled person. So whatever skills I have developed, it's all because of the hard work. So any hard work definitely will have a success.
Sir, and we all know that you're very good in teaching, sir. So at which point of life did you feel that probably I really want to be a teacher? I want to educate students and share the knowledge I have with them. So being a doctor, you might have had other interests as well in other subjects, but which point of life and space did you feel that anatomy is my subject and I really want to go forward with this? What gave you that clear bifurcation, sir?
So that is because by default I joined anatomy department at Ballari, Government Medical College, Ballari. So actually it was the toughest department when compared to the other departments. So the toughest was that because of the HOD. So that dedicated teacher made me an anatomist. So he used to encourage me, in case if you get postgraduate, you better take anatomy. So it has a better future and wherein you can learn the subject and It's a foundational subject for medicine. So I still remember my teacher where I was teaching in the year 2003. So that made me to take anatomy. And luckily I got anatomy postgraduate at Bangalore Medical College and Research Institute, Bangalore in the year 2005. So that's how it went on.
So it has been a very enjoyable journey for you. I can say that with the way you're actually talking that you're extremely passionate about the subject, sir. So like, sir, when you were an undergraduate student or even a postgraduate student, probably there was not much exposure about the subject as such.
100%.
YouTube videos were not available. As of now, there are so many online platforms also where we can take help from as such. But those things didn't really exist in your time. So how is the difference you feel, sir? How students adapt to anatomy as such, how we look at anatomy, and how you as a undergraduate and postgraduate handle the subjects. What was the difference you really feel, sir?
So I feel this, whatever this you told, medias, so they're all supplementary. A physical teacher is always a physical teacher. You can learn much more than from the physical teacher. How many videos you see? Because at the same times, there are a lot of diversions. Once you open the YouTube, you may concentrate for 1 hour. There afterwards, we go for the entertainment programs. So instead of that is a lot of disadvantage rather than advantages. See, cadaver is a must to dissect. Maybe you can see the cadaver dissection in the videos, but that will not help you out 100%. You have to dissect. You have to physically go to the wards and learn the subject. You should physically go to the lecture halls and learn the subjects. Not that by seeing the videos I can learn the subject, a lecture classes. That is not at all possible. It can be a supplementary to the main course.
Nothing can beat hands-on experience. That's why we see all the anatomy professors are extremely extraordinary in their profession, and we're so thankful for that, sir.
Thank
So as we come to an end of this session, I would like to thank Dr. Parashuram, sir. Thank you so much for joining us, sir.
Thank you once again.
It's been a pleasure.
Good afternoon, sir. We have Professor of Preventive and Social Medicine, Dr. Manjunath, here with us.
Very good afternoon. ಎಲ್ಲರಿಗೂ ನಮಸ್ತೆ ನಮಸ್ಕಾರ.
We'll start with questions, sir. As a professor of Preventive and Social Medicine, how do you implement the concept of prevention is better than cure?
I would like to start with a disclaimer that there is no conflict of interest and there is only interest of the institution and the students. See, prevention is better than cure is a old adage, but I would like to call it as prevention is the only cure. The entire focus globally now is towards one health or holistic health, which means try to prevent diseases and promote wellness as much as possible. How do we implement means the entire curriculum, whether it is medical curriculum, veterinary curriculum or any other curriculum across all disciplines, it has to be centered around wellness. When you are talking about wellness, when you are conducting discourses about wellness, when you are doing research about wellness, naturally we are talking about prevention. So there is a new concept called as salutogenesis. We have all heard of pathogenesis. As students, you know what is pathogenesis, but do you know what is salutogenesis? No. Salutogenesis means prevention. How do we preserve health? How do we promote health? As you all know, there are different types or levels of prevention: primordial, primary, secondary and tertiary. So all efforts, whether it is program, policy, various curriculum, we focus on more competencies, more sub-competencies, more objectives on prevention. Through that approach, we will try to promote more of prevention rather than curing disease. We call it as a reverse pyramidal structure, or you can call it as a routine pyramidal structure also, where the base is prevention. And once you fail to prevent a particular disease and the disease manifests, then the curative component, rehabilitative component takes over. So the underpinning and the base is always prevention.
So what's one lesson from the field, something you saw outside the classroom that you think every medical student should learn?
I have seen so many things in my 32 years of experience, 25 years as a teacher in this institution and 7.5 years as a medical officer in a remote peripheral primary health center in HD Kote Taluk. One thing I have seen in the field is, which is a shame for all of us, is open air edification. This has haunted me all through, and this is one thing which is to be corrected. And if you, this is the one thing which has struck me deep inside, so that whatever I talk about, that is hovering around hygiene, whether it is a personal hygiene, whether it is a mental hygiene, whether it is social hygiene. We slowly graduate from personal hygiene level to social hygiene level. So this is the one thing which has struck me in the field.
As a professional, you have learned this. As a student,
Yes, as a student, when I was in second MBBS in the same college, 1987-88, in that period, I joined one organization called as National Medicos Organization, which was a voluntary organization. They took us to a small village called as Tikaturu, which is around 20 kilometers from this place. When we went there as a group of volunteers, actually our goal was to clean that village and educate them about hygiene, sanitation, and of course constructing and using latrines. Imagine, almost 40 years back. Then one of our batchmates, a girl student, wanted to use washroom, but there was only one washroom in the entire village. That was in the Pradhan's house, and that person was not there. So that was one situation which made us think, contemplate about the existing situation and how to go about from that. As a student, I was struck, and probably that is the first trigger for me to look up community medicine as a career later on.
so coming to our next topic about empathy. Do you think empathy can be taught in medicine, or is it something innate?
This is one question which is often asked in many platforms across the globe, but I fail to understand why we have given empathy so much of importance and why we are deprived of this basic attribute. Actually, empathy is there in all animals. As a scholar, doctoral scholar of anthropology, I have studied the evolution and I have understood that empathy is hardwired in all animal species, and in human beings also it was in good measure. But unfortunately, as the civilization progressed, the competition increased, material outlook increased, took a center stage, and slowly empathy started vanishing. But we all need to remember that empathy is the most important attribute for any healthcare professional, not necessarily doctors, across all professionals, nursing, dental, Ayurveda, physiotherapy, whatever you call, name. So this empathy is, if you want to look at this, what it is all there in our brain, in our genes, in our hippocampus, in our limbic system. So it cannot be taught. Empathy, whatever is there inside, has to be brought outside, it has to be polished, it has to be nurtured, and we have to see that it gets manifest, especially among all medical students. It is not an alien attribute for us.
So, do you think our course has been giving us enough time and teaching it properly, empathy, to us?
Empathy cannot be taught. What has to be shown should not be taught.
Can it be polished?
Yes, what I am trying to tell is it has to be demonstrated by us teachers. See, if you see role models, if you see people manifesting empathy in their day-to-day life, for example, if your professor, if your teacher is demonstrating, exhibiting empathy in all their endeavors, maybe in teaching, maybe in bedside, maybe in the field, then automatically you imbibe. So what I tell is, empathy is not taught, it is caught. C-A-U-G-H-T. It is not taught, it is caught.
So, and sir, coming to family adoption program, what is the significance of family adoption program from student and the family's perspective?
Significance of the FAP on from the students.
From
For
students
whom?
and the family's perspective.
See,
Why is it there in our course?
why is, I'll start with the latter part of the question. Why it is there in our course? Family adoption program is one of the most novel experiment being done by NMC in India. It is one of its kind in the entire world. We should be very proud of this program, because nowhere else you will find a program like this. There are similar programs in different places, but not family adoption program. See, this family adoption program was done in Mahatma Gandhi Institute of Medical Sciences, Sevagram, which was started by none other, which was started in the name of Mahatma Gandhi. There, they found this family adoption program very successful. Then NMC thought, why not implement it to the whole country? The core essence of this FAP is the student will understand the natural environment of the patients in their family setting, in their community setting. Then you will know what are the social determinants of health. Now, social determinants of the health are far more important than the biological determinants of the health. So, this is a win-win situation. We have got wonderful experiences where students who have adopted the families have been contacted by the family members in cases of any queries, doubts, medical emergencies. It is a sort of a point of first contact if they have a medical query. I'll give you just one example. Recently, one of your juniors was, maybe your batch only, I don't know. She was contacted by one of the family members that a monkey has bitten her daughter, whether she should take rabies vaccine or not. Now, because of this family adoption program, she had the contact number. She called her up in the night. She in turn called me to check whether it is required or not. I informed her, in turn it was informed to them that yes, it is better to take ARV. So, the point here is everybody is benefited. The students are developing some ownership. They already feel that somebody is depending and relying on them for health information and health care. So, this is a fantastic program, but there are certain operational constraints that, especially in our institute, if we iron out these constraints, probably this will be one of the most beneficial, meaningful, relevant program ever in our country and also in our institution.
So what are these constraints, sir?
Constraints are, one is to reserve slots in the timetable, because we have to take 3 batches simultaneously to FAP to far off places. So, we need logistical support in terms of vehicles. And now 200 batches come, now 250 batches arrived, we are conducting a foundation course for them. So, to take these large batches in small groups to far off places is very difficult. That is the first point. Second one is safety of our students in terms of stray dog attack, in terms of other issues. So, if we can take care of this logistics, safety issues, and then this probably students will definitely enjoy this process. There may be initial resistance, hesitancy, etc., but once they immerse themselves into this program, they will definitely learn and enjoy the process of learning.
So, sir, coming to the last question, if students could take one message from your experience, what would you want it to be?
So, if the students listen to this, my single message is, mark my words, the changes that you will see in the next 10 years will be far greater than the changes that took place in the last 100 years. You will be sailing into uncharted sea with a lot of challenges, lot of uncertainties. Be prepared for this, build your personalities, develop resistance, develop communication skills. That is my piece of advice to you.
Nice, sir. Thank you. And sir, like one last question. It's about empathy.
Yes.
We'll go back to it.
Go ahead.
Have you ever seen a moment when empathy made all the difference in a patient's case?
Just quote one very recent example. I saw an elderly lady around 73-year-old being diagnosed as anaplastic carcinoma of thyroid, very late diagnosis. So, she underwent total thyroidectomy, and they felt that the family felt that she cannot sustain radiotherapy. Even the treating oncologist said that that is enough, let us give her palliative therapy. Her lymph nodes were bulging, she developed very severe pain in her neck, head and left arm because of the meds. So she could not move, she could not eat, she was in unbearable pain. Morphine was started, then painkiller patch was in place, but still the pain was unbearable. So I was treating her family since a long time, and I had only referred her for the diagnosis. So they came to me, what is to be done? I said, you do what you like most. I told her to listen to Ramayana, Mahabharata and other things, listen to some of this Vishnu Sahasranama, Lalita Sahasranama and all that. Apart from that, I told her that you talk to me every day for 10 to 15 minutes. So they were updating me what was up, what happened with morphine, vomiting, so many side effects and all that. So I was just counseling and convincing her. Every day she used to call me 10 to 15 minutes. I used to talk to her, sometimes video calls, sometimes they used to bring her in to my clinic. So this she was telling, and also I asked her to undergo one course of radiotherapy to reduce the burden of pain, and it also helped her to some extent. But what she told was, she is still pulling on. She tells that if I call Manjunath doctor for talking, it gives me a lot of relief. See, I talked to her only for 10 minutes and I will answer all her queries patiently and without any problem. So that's answering her routine queries like, can I eat this, can I have that juice, can I lie like this? Simple, anybody could have answered, but those simple answers from my end soothes her. So this shows that she says that if I talk to Dr. Manjunath, I am comfortable. That day I feel I am okay. So you make an inference out of this.
So do you think that the doctors should be the most empathetic creatures out there?
As you rightly said, doctors should never be short of empathy. That is my statement. We should never be short of empathy, but empathy is an universal attribute. Each professional should possess it in good measure, and more so doctors. I agree with you.
Thank you.
Thank you. Thank you.
Hi, sir.
Hi.
Can we steal 90 seconds of your time, sir?
All yours.
Mountains or beaches, sir?
Beaches.
Okay, your favorite thing about the whole MMCRI campus?
Pond. Because I have a lot of memories being an alumni.
Tea or coffee at any time of the day?
Tea.
Restaurant food or home cooked meals, sir?
Always home cooked food cooked by my wife.
Favorite dish, sir?
Rice and sambar.
What is your ideal way to relax after a long day of work, sir?
Ideal way is playing either tennis or badminton.
So, do you prefer a student life or a professor life, sir? Which fascinates you more?
I am still a student. I am studying medicine for the last 39 years. So, student life is always best, and I remain a student for my life.
Thriller film or a comedy film, sir?
Thriller comedy.
That's hard to find, but good choice. Were you a backbencher back in your UG days, or were you the sincere friend bencher who used to not skip any class? Or
It depended on the subject and the teacher. I was finding myself all around, depending on the subject and the teacher.
what's your favorite spice food, sir?
Spice food is vegetable biryani.
Early bird or a night owl, sir?
Night owl.
You prefer to work at
I am a what is called as Chandra Vamsha person, not Surya Vamsha.
movies at the theater or movies at the halls?
Both I enjoy equally, but people who are close to me should be around, whether it is any place, theater or home.
That makes sense, sir. Thank you so much, sir. That's your time, sir.
Thank you.
So we'll start off with a fun round, sir. It's rapid fire questions. So one word answers.
Yes.
If not a doctor, what career would you have chosen?
So, doctor profession was the only career which I chose, and I hope there was no second option for me.
Yes, sir. Favorite comfort food?
Vegetarian. Dosa
Specifically,
idli.
dosa idli.
Dosa idli.
One gadget you can't live without.
Cell phone, mobile phone.
We
Lot
know,
of
sir.
communications.
We've seen. One hobby you wish you had more time for?
That is shuttle badminton.
Badminton, sir.
Yes, I used to play. Almost for 5 years I played. Thereafterwards, I slowly reduced because of lack of time.
Blackboard or PowerPoint in classrooms?
100% blackboard.
Blackboard.
There is no doubt.
We agree, sir. If your life were a book, what would its title be?
A little bit lengthy sentence. Books and friends should be few and good.
If you could invite any three people, alive or dead, for dinner, who would they be?
Parent, teacher, friend.
Yes, sir. Administration, work, or teaching?
Both simultaneously. It's like two faces of a coin for me.
Nice one, sir. When you walk into your department every morning, what's the first thought that comes to your mind?
First and foremost is I salute my Almighty. There afterwards, what are all the tasks should I need to complete? That's the first mind I come across.
This one, sir. Thank you, sir.
Thank you very much.
So, sir, both of you have been, an integral part of a student's life. One through academics, one through student welfare. How do you think these two complement each other?
I think both are like two faces of a single coin. So one is the academics, the other one is related to the welfare of a student. So, in my opinion, both are one and the same.
Are we running a boot camp here? No, we are trying to train our students. So, for that, the fundamental prerequisite is welfare, safety, comfort, happiness, readiness. So, welfare and academics are reciprocal determinants. So, wherever there is welfare, academics will flourish. It is as simple as that.
Sir, what has been the most challenging part of balancing looking after the students as well as the academics? What has been the most challenging and the rewarding part of it, sir?
The challenging here is student, of course, but much more the students are interested in extracurricular activities. So that is a challenging.
Yes, I would like to completely endorse what Parashuram sir said. Would like to continue that academics is the sine qua non of any medical college. Having said that, the challenge, if you want to come to the challenge part of it, there are competing priorities and interests in our student population. Very heterogeneous population with varied interests, varied goals, varied approaches to bring them together under one umbrella and deliver the curricular component is a real challenge. Not only in MMCRI, it has post-COVID. Academics has been a major challenge across the globe. Attention span of student has come down. Didactic lectures have lost their significance. Lesser engagement both from the side of the students as well as the faculty. So these are the challenges. What is the rewarding thing? We see our students excelling in academics, in the university examinations, NEET PG examinations, and also in so many extracurricular activities. We see them conquering various frontiers. So this is once when we see people, students coming back and telling us, "Sir, I got a prize in the quiz," and when we see them organize wonderful events like Vegas, Samskriti, Krida, and all, we feel that yes, we are on track. So we do have this both types of experiences.
So Dev, I was thinking about this the other day. What does actually like education mean as such? Like we have a lot of classes. We also go to classes for attendance, and we have a lot of exams coming up. We prepare for them. We face exams, vivas, etc. But what do you think actually education means to you more than marks and attendance in regular curriculum? What do you think about it?
Well, as a student, it means the first thing is getting the knowledge of the class, then the attendance, and then the exams. What's your take on this, sir?
What I feel is that education is not just academics. It is the holistic development of a student in terms of the mental, physical, emotional, spiritual, and over and above, education is, since ours is a noble profession, so we need to serve the society. and humanity component should always be there. So I feel education is overall a character, values, and holistic development of an individual.
I feel education has lost its meaning at all in the first place. Education is a continuous process, the chief goal of which is to bring about a relatively permanent change among the learners with respect to acquisition of knowledge, skills, attitude, and behavior. But I feel this is a very tasteless description of less applicable, less applied description of education. So, my definition or my explanation of education is it is a process of holistic empowerment of an individual in order to create choices and opportunities to realize their potential in life. This is Manjunath's definition of education.
So, continuing on that thing, do you think the modern student has more opportunity or is under more pressure?
Uh, if you see the scenario, there is a lot of stress among the students, among the stress, among the teachers, and in the society also. We think that we are developing, but finally, where we are going, we have no idea. So there is a lot of opportunities also at the same time. But I feel that we need to reduce our stress. So if we can see our parents, grandparents, there was less stress, they were happy, they were healthy, and so on. I think they were comfortable also. So this era, I don't know, including me also, I personally feel there is a lot of stress among the students. They are unable to concentrate on the studies. So I think this is the most important part which we need to focus.
Right, sir. So,
By and large, I agree with what Parashuram sir said. To extend it a bit, there are 2 points here you have made. One is you spoke about stress, another is opportunities. Now, having graduated from the same medical college in 1992, I belong to 1986 batch, alumnus of this college. So I can relate myself to my time and this time. And my father was a medical, I also was a medical student in 1952 batch in the same institute. So I used to hear stories from him. So to summarize, I would say in the previous year, first of all, it is difficult and not fair to compare previous eras with the present era. But in case if you want to bring them in a single framework and compare, in our era or in the previous generations, the stress was system induced. The entire medical education system, assessment system, passing criteria, passing possibilities and probabilities were very less. There was more of regimental programs. So the system induced stress was very high. Whereas now, system induced stress is very less for you people. We are all like friends to you. Yeah. In our time, to talk to a professor was difficult. But here you just call us and tell, sir, please come here, are you taking class and all. So system induced stress is very less. But unfortunately, self-induced stress is all-time high. You people induce so much of stress among yourselves because you start focusing on NEET PG, future life, what I will do at the age of 50 and all. We were never worried about post-graduation. We were never worried about life after MBBS. Our only job was how do I pass this exam? And these screens, gadgets, technology has induced so much of you post something in WhatsApp or Instagram and you keep watching what is the response I am getting. Whole night you will not sleep. So it is a self-induced stress, but in our time, system-induced stress was more. Then coming to the opportunities, here there is a clear-cut difference. Opportunities have increased many-fold these days. Whether it is research opportunities, going out opportunities, networking opportunities, resource, material opportunities, learning opportunities are many-fold now. During our time, or even in the previous generations, we used to go to a library, sit and read. There, everything, all opportunities were limited. But it is now because of the technology, thanks to technology, the opportunities have increased. But the opportunities are so much that again you people are confused. So again it is a catch-22 to situation.
Sir, just that you mentioned about technology and the upcoming resources that we can use, I feel that the technology which is being like induced at these days has actually increased the competition more among the students. And as competition has increased, there is also a lot of expectation around us, which has been created by our parents, teachers, peer pressure. Everything is there, and we have to constantly try to outshine people around us to sustain in the field. So, do you think that part of stress would affect academics as such?
You have to bring the best in yourself. Competing with others is never going to be fruitful. It will burn you out.
So, the 2025 batch students have recently joined our college, sir. So, and our college is filled with vast variety of resources like clinical postings in the morning, and then there's a whole new library there with stacked up books. We have a big study hall to actually sit, read in a very peaceful environment, and lots of other resources as well. So, if you would want to guide them on how to use those opportunities in a proper way so as they manage time, how would you actually guide them? So, what is your message to them?
My message to the students of 2025 batch is that we have a student mentorship program, so that wherein we once in a month, so whatever students are there, so we can discuss in that program and see that most of the students will get benefit. And we have a library component also, wherein we have a good number of reference books for the UG students, especially they can make use of those things. And of course, we are coming up with the digital library also. So in future, we are also coming up with the skill lab for the second year and third year students. So thereby we can guide the students.
Yeah. So coming to the last question, what's one change you hope to see in this campus 5 years from now on?
So first and foremost is we need restrooms at various points, especially for the UG students. They have lot of issues with it. We need to have a college canteen also, because many a times students, they come to the college empty stomach, they cannot concentrate on the studies. So canteen is mandatory.
Okay, well said, sir. Apart from the infrastructural changes that sir spoke about, I would like to add two, three more to the list. One is more intense, immersive, curricular, and pedagogical engagements from students and teachers. Another one is more quality research inputs in terms of research projects, grants, and publications from both students and faculty. This is what I would like to see our MNC to accomplish in the next 5 years.
Thank you, sir. It was actually, we are very grateful that you brought about practical points that should be implemented. We are really looking forward to it, sir. Thank you so much for your time, sir.
Thank you, sir.
Thank you. Best wishes to all.
Thank you, sir.
Thank you, one and all.
Thank you, sir.
Jai Hind, Jai Karnataka, Jai Vamshi and Mysore.